located in 87 Mall, Kinoo. It's a new level 3 hospital yenye imefunguliwa hapa. Na kama kawaida, in this channel we discover and we give you good information about places where you should go. So, leo nimekuja kufanywa some services and then the doctor tell you what they're going to be and the services they're offering. So, come with me and let's get to know what MDH offers.
Consultation room 1, So we have 2 consultation, 2 and 1.
Okay.
Consultation 2 belongs to me. Here serves as the admin's office.
Hey.
Here hapa ni consultations are
Okay.
room 1.
Dr.
So in my office.
Really consultation
Dr. Price and Dr. Juma.
Yes, in the examination coach, we do our examination after finishing up with the history taking.
Okay.
And we have hand washing area. Where now after you're done with the patient, everything you just have to wash your hands.
Yeah,
Some infection prevention.
lazima.
Yes. Otherwise, you could do sanitize kujiosha mkono. As I love the same so about infection prevention and control. So the part like every other service delivery point as a part of a tab. Yes, for the purpose of when you're done with the client, or even the client can also wash their hands in case of part of them. Now, by the way, we don't do paper work.
You don't do paperwork?
So we operate on a software.
Oh,
so
digital.
Yes, so everything from the reception up to the lab, to the observation room or our recovery room, to the pharmacy. There is no way you're going to touch a paper.
Wow.
The only time you're going to touch a paper is if you want to have a hard copy of the receipt.
Yeah, ukiandikiwa dawa.
Because the receipt
Have prescription button is online.
Online?
Yes.
Everything is
Unanitumia email.
Yes.
Actually, you can create your account here. You can book your own appointment from home. Ukibukia daktari kama unataka kuonekana
nikitaka like kupigia daktari ama kubuka an appointment, I go to a web. Do you guys have a website?
Now, the software we're using, we have 2 versions. We have the one that is uses a server. We also have another one that is cloud-based. So for the cloud-based, if we create your account here, like we register you as our patient, you automatically have an account in that software. So you can log in, you can see your medical history,
So
you can book an appointment from home.
But you will only be given permission to access your own account. You can't see anything else. It's about account only.
Also say nini iko sawa, privacy, security is okay.
Secure. Yes. So kazi itakuwa rahisi.
Our servers are in France.
Rahisi. Sasa unaona nyi watu, these people are the ones they're going all digital and all, like that's so nice. Tunakosa kazi lakini ndio tunataka kuandika.
Our servers are in France, like IBC.
Kazi itakuwa the more tunaenda digital, the more people are very creative. Kazi itakuwa.
Lakini no, by the way, this is so nice, and even the fact that you've chosen to go like digital and not like using papers and all that, that's really amazing. Na unajua pia inapunguza hata nini.
Tuna space ya kuweka files na hizo tunaweza kuja mtu akuja haribu mahali.
I know. By the way, and it makes it inafanya hospitali by the way kind modern. So you know.
The one is gist.
Okay. Sawa. Hey, gist. Hey, I'm going to learn new words today. Gist. Yeah, inafanya hospitali purpose. Normally unaingia hosi unapatana na files ziko kwa ukuta huko, makadi.
So you need to give me your name or your phone number, I can get your file.
Wow. That means you don't even have to come at buying a card or anything.
No.
Wow.
No. So now, for those who don't have like emails, now you can have printed copies. You can do printed copies for their receipts,
if you don't have an
or anything. But if you have an email, you do everything sent to your email. Even at the point of registration, if you have an email address, you can give it to us. We put it in your account. Yes.
That is awesome. Watu wangu nimesema hilo inabamba. MVH.
So go to the lab now.
Yes, let's go to the lab. Unafanya surgery.
Tenda hizi nyingine. So this is our laboratory.
Okay.
For now, we are utilizing this as the phlebotomy area.
What meaning?
Phlebotomy ni pale mgonjwa anatolewa sample.
You are lying.
But from next month, we are creating another room there to be the phlebotomy. Ako karoom katakuwa phlebotomy sasa.
Get in the frame.
Oh, okay. So we have machines here. So this is a biochemist machine. Hii ndio inaweza angalia kitu kama inafanya liver function test, inafanya kidney function test, inafanya lipid profile na zingine mingi zaidi.
Wow, like okay.
Ukitaka like a fully body check-up, utakuja consultation for examination of the tumor lab. So basically these are the machines we are using.
Okay.
So this is for what we call biochemistry analyzer, and then we have another one there.
This one.
This is a
Centrifuge. Separate your serum na hizo blood cells ziko. Kuna test zingine zinatakanga hiyo serum peke yake. So lazima kinini hapa onyesha. So kizunguka hivyo na separatisha serum hizo blood cells. Kuna sample hapo unaweka.
Ukiweka sample
ya blood.
Okay.
so my center and so double for my bottle.
Kama
put inside there.
Oh, iko kwa chupa ina separate.
Yes,
Yeah, kwa chupa kama hii.
you get the cells and the plasma.
Wow. Hey, okay. I'm not allowed to touch.
Can touch.
Hematology machine here. It's tunapima full hemogram.
Full blood count.
Full blood count.
Oh, okay.
So if you want to know if you have an infection, this is the machine. If you want to know
Like
if
a
you
blood
have enough
infection,
blood
no?
or your blood is thin, you use this one.
HB, anemia, detects all anemias in your machine inaweza kuangalia kitu kama hizo zote.
Mnaona ni watu. These are fully equipped hospital. So ukikuja hapa you're very sure of the best, you can be guaranteed that you're going to get the best services. This was daktari.
What's
Na
microscope?
sasa kuna hii microscope na I've always wanted to look for like kuchungulia hii kitu.
Now you have the
Naonanga tu kwa movie.
Maybe unaweza fanya hivi. Maybe you can get a sample, maybe of your urine.
Yes.
Then tutaita daktari akuoneshe what they will see.
Aki.
Yes.
Naonanga tu kwa movie.
Sasa waangalie.
Niangalie.
But ni vizuri angeangalia kama kuna kitu
Kuna sample.
ndio kama kuna kitu yenye inaweza onekana.
Sioni anything.
Sawa, sasa wacha
The
tukueleze
light
sample.
huwezi ona anything because there's nothing hapo. Hakuna slide, hakuna anything. So until they put a slide, there's a sample on top. You unaweza ona something hapo.
Wow. Okay.
Tutatoa sample kidogo before uende.
Unaweza
Then
kuona
niangalie,
hiyo kama
sio?
urine analysis.
By the way, tujue atakani kwa
Mimba hizi onekana kwa hiyo lakini.
Yes.
Mimba ni ile kipimo ile tu yenye
ile tu moja.
ile moja hiyo ndio mimba.
Oh, so this is the minor theater.
Minor theater stroke procedure room.
Oh,
Can get it.
So hapa mnafanya surgeries.
Minor surgeries peke yake.
So by minor surgeries unaacha like small
Kama stitching, remove of ganglions. Kama ni kama tissue inatoka under the skin, so hiyo tunaweza kutolea hapa. Circumcision.
Okay. Oh, okay. Nilikuwa nataka kuuliza like tule unajua kuna pimples mtu upata fulani and then it's like keeps coming back. It keeps coming back at the same spot and it's a bit new.
That's because a lot of things in the skin. But sometimes you get closer.
Okay.
Sio kuna hizo rods.
Yeah.
Tunatanga cysts. Ndio mtu anaweza fanyia removal. Kuna excessive fat. Kuna mtu anapatanga fat kwa chini ya skin. Simuona mtu labda akona kitu kamefura, but it is just fat. So that one can just yes.
Wow. Another machine here. Ultrasound machine. So this is one of the best in the market. Ito Mindray ultrasound machine. So for now tunafanya abdominal ultrasounds and pelvic, but tukiongeza probe nyingine kama hii hapa, probe tunafanya na probe nyingine tutaongezewa hapa next month. Sasa hiyo tutaenda kufanya mpaka testicular ultrasound, breast ultrasound na hizo zingine zote.
Wow.
For now ni abdominal and pelvic.
For now. But by next month you guys are going to be like doing all of them. Surgeries. Hakuna haja ya kwenda Kenyatta. Wow. Observation. So hii ni kaa ward.
This part inahitaji like a pillow for the patient.
Yeah.
Akilala kama anasikia amelala vibaya,
Anaweza lalisha
Can
kitanda.
adjust. Let me show you.
in the gym.
Tuna ikienda, you can adjust.
Wow.
Kama anasikia hajalala vizuri, nasema baada kwa
Check kidogo.
Na haiwezi panda like juu.
yote. Sasa yote inaweza panda, kuna other levers
Oh, okay.
Hizi other levers
Oh, ukizisimamisha.
Yes.
Oh, okay. Wow.
kama hizi
Observation.
kama hizi ni za kustop patient asianguke.
Oh, yeah.
Block this one.
Oh, in case I
I
roll.
think iko locked. So kama kuna mtu mwenye unaona anaweza anguka kwa kitanda, naziamsha.
It is very strong, hata ikipushwa is giveaway.
Okay. By the way, guys, unaona hii observation room vile tu nimeiona, kitu cha kwanza nimehit changu ni nikikuja kujifungua. No, this is it for me.
Karibu
Juma,
sana. Karibu sana.
omba nipate mimba sasa, hii mwaka nikuje hapa.
Mimba hiyo
Tufungue maternity wing.
Pia mzee afanye kazi.
Si ndio?
Afanye kazi.
Mzee kazi ndio changamoto.
Afanye kazi.
Wa? Hii sasa hata naona tutafungua maternity wing. Unajua? Wow.
This is our pharmacy.
Kwenye madawa ziko sasa.
Fully stocked. Madawa zote, antibiotics, painkillers. Zote
Zote
you can any medicine you can imagine is well stocked there. So mgonjwa akikuja kutibiwa hakuna kwenda kununua dawa nje. Dawa zote
atake.
Yeah. Unless hiyo dawa iko hapa, but zenye ziko hapa zinatibu kila kitu.
Juu ya hiyo story kuna daktari kuuliza kama uko
Sawa.
Okay. Tumefika sasa consultation room 2. Daktari mkuu. So guys, I'm here with Dr. Juma. I want him and Dr. Price, I want them to tell us some few things about our health issues na nini. So acha kwanza watu introduce hiyo video.
So I take this chance to welcome you to MDH Medical Center. MDH is a short form for Morning Basis Health. So this is your home for cervical cancer screening and all type of cancer screening. So our hospital is divided into the normal illnesses. We take the patient through the consultation, triage, anaona daktari, anatumwa lab na anatibiwa. Then there is the part whereby we do community outreach. And by community outreach, I mean we do free cancer screening, free blood pressure check, free blood sugar checkups, and what else? For free consultation. So for a patient who came for the outreach program, the consultation is usually free. Okay. So the whole package is free.
It's free.
Yeah. So for now, I'm going to welcome my colleague to take you through the education.
Yeah.
before we can do the screening.
Dr. Price.
Yes.
Wewe nitauliza maswali
Very ready.
Nimekuja kufanyiwa hii nini cervical cancer screening.
Karibu sana.
Honestly, I'm a bit scared because you know what?
Don't be scared.
Because you know there are services that nimefanyiwa before and then they're so painful. Anything that involves, you know, your cervix.
Yes. So
Yeah, so I would like to ask kwanza utuambie about cervical cancer screening. What is it about? Like, how often should people be doing it?
okay, so
Generally, where to nifunze.
okay, I want to start by also throwing the ball to you. You tell me a few things you understand about cancer, and I can take you through cervical cancer screening. So when you hear about the word cancer, what comes into your mind?
When I hear cancer, I think of mimi nafikiria tu ukikatwa matiti, ukikatwa. That is what I think of when I think of cancer.
Nafikiria zile vitu mbaya tu.
But anyway, you see now everyone has their perceptions, you know? And it's true. Hata sio peke yake mwenye kisikia cancer anataka kushika kichwa. Everyone anakisikia cancer ni death, poverty inakuja, you see? Pesa itakuja kuisha. So, but come to think of it, cancers, most of them are treatable, but it depends time and detection. So when we detect most of these cancers early, we have enough time to prevent hizo maneno za kwenda India, kwenda wapi, si ndio?
Yeah.
So cervical cancer is a cancer that affects the cervix, and cervix, kwa wale watu wenye maybe hawakushwa ni nini tunaongelea, is the opening of the uterus, the door, or the gate to your uterus, you know? So the cervix, the part that usually keeps the baby inside the uterus for 9 months, but when it opens, everything has to come out. The baby plus the placenta and any other thing in your inatoka. So it is a very important part.
Yeah.
Now, cancer of the cervix usually starts at the cervix, but when left untreated, it spreads to other organs like any other cancers.
Yeah.
Because cancers mainly, kuna kitu inaitwa malignancy. Malignancy ni cancer ile iko na uwezo ya kusambaa na kusambaa ni ndio tunasemanga metastasis, ndio? So for cervical cancer, it is caused by an infection. Yes, for those who never knew. Cervical cancer, it is caused by an infection. The infection is caused by a virus called human papilloma virus. And the human papilloma virus is responsible for many other types of cancer. You can have anogenital cancer, you can have the oropharyngeal cancer, you can have these warts. So the HPV, there are very many subtypes that cause different types of problems. But specifically for cervical cancer, zile ziko majorly responsible is subtype 16 and 18. So na hizi virus, it takes time for the virus to cause problem. Yes, see ati utapata the infection today, then tomorrow you have cancer. You can
Mheshimiwa. It's okay. We have a boss here. That's our boss.
So, for the subtypes 16 and 18, they're the ones responsible for causing cervical cancer. So this happens when you have repeated infections with the same type of virus.
So the same name over and over again.
Yes, so if you are exposed to the HPV, like every now and then your risk of developing cervical cancer is very high in future. When you get the virus, it takes 10 to 15 years for that thing that we see when we do the screening to appear. So it means you can have the virus for many years without you knowing you have the virus.
Oh, inaweza kuwa dormant for a certain...
Not really dormant, but how it progresses from this step to another step, it takes a very long period of time. Now there are other factors that can make it move, as in progress very fast. something like if you have issues with your immunity, inaweza acha kuenda polepole ikue haraka. So that not necessarily, but pia kuna those risk factors yes, so mambo kama ya mapombe, vitu kama hizo yes, kuna hizo risk factors so okay, ndio mtu apate cervical cancer lazima akuwe na repeated infection with the HPV virus. Yes. Sasa
hiyo ndio inatoka kwa mwanaume.
Yes, inaweza toka kwa mwanaume, bali inaweza toka kwa mwanamke because kwa mwanaume ni kwa sababu men can have that virus, but because they don't have the cervix, it cannot cause problem in their body when their system. Sasa because inahitaji like that area ya cervix, kuna specific cells zile zinaweza ichukua na zikaingiza kwa mwili, sio? So tunapata like you can be married, hata unaweza kupata kwa married na only mzee mmoja, but mzee wako ako na HPV. You see, so every day you have sex with your mzee, most likely you use condom because mzee wako you're very faithful to one another, sio? But every time you have sex with them, they give you the virus. Every time you have sex with them, they give you the virus and you don't know. But the good thing is, this virus, as much as inaweza kuwa inaleta mashida kubwa hivyo, the body is able to clear it even without problem. If your immunity is okay, you can have the infection today, but within 2 years, it is over. Okay. So for you to develop the problem, it means the body now is overwhelmed. It cannot even fight anymore. Yeah. That is when now inaachilia. Okay. Now your virus ifanye vitu zake zile inafanya. But the good thing is that you have a lot of time to prevent this thing from developing into cancer. That is why we have now the screening treatment modalities. Oh, yeah. So for screening, we have very many types, several types methods that we use to do cervical cancer screening. Yeah? So, but these methods zinatofautiana kulingana na pia mambo tofauti, sio? Kuna the cost, kuna availability, so unaweza pata like yes ziko mingi lakini unapata this place only offers this type of screening, sio? So for one we have VIA, which stands for visual inspection using acetic acid. Acetic acid is your vinegar, the one that you use to tenderize nyama, sio? That is very important, but now the one that we use is specific concentration. It has to be a specific concentration. So there's that one VIA, then there's another one called PAP. I know you've heard of PAP smear, isn't it?
Yeah, PAP smear.
So PAP smear is also another way of screening for cervical cancer. Yeah. Also another one, there's something we call HPV test. So HPV test and PAP, those ones inafanyika kwa lab. So for PAP, in other words, tunaitanga cytology. So involve kutoa a few cells for the cervix, but atukati there's a special brush. You use to brush upward in the area of the cervix, then whatever itashika for that brush is put for the medium, then it is taken to the lab for analysis. Then there's that HPV test. So the HPV test looks for that virus kwa hiyo cervix yako. So also that one has to be taken to the lab. So the same way vile unatoa PAP, here is the same way utatoa the HPV, but now it involves different way of packaging na kuipeleka kwa lab. So the HPV test is called an antigen test, and it is very specific, but it is very expensive. So even you having that virus does not mean that you have the cancer. So you can be doing HPV test in a turn positive, kupana pressure kwa kichwa yako, sijui mimi niko na HPV, but you don't have the cancer. So at times if you want to have the HPV done, you get it done. Ujio kwa nayo, at least pia itakusaidia pia the scheduling ya screening, because when the test turns positive, then tutakwambia this is how it's supposed to be screened. For us waiting to see the signs, so that when you see the sign, then we treat. Yeah. Because if you have it and there's no signs, it means your body is working on it. So now hii ingine inaitwa PAP. PAP is also good, but also PAP sometimes is unaweza ona but hakuna kitu utafanya about it. You see, because inaweza kwambia hii kitu mahali iko si kitu inafaa kupa stress, achana nayo. No. But now this test tunaita VIA is very important test, because ukifanywa HPV test, the antigen test, na itoke positive, you will still be told to come and do the VIA for us to see if there are signs. So the VIA is the most important, because even if you get your pap and it shows there are cells that's in the term cancerous, you have to get back to the VIA to see where are they. So primarily I prefer VIA to any other, because VIA is cheap, and also the skills that mtu anahitaji sio zile ati, it's very simple. You need some training, anakuonesha vile utaitaka report yako, and also now even the treatment for those who screen positive for VIA is also very simple. So for pande ya screening tumesema hizo tatu, si ndio? So when you screen someone and they must, let's say, the VIA and they are positive, because if you screen HPV you'll have to go back to VIA to see where is it, how does it look like. If you do HPV, if you do cytology, that is the pap, you also have to go back to VIA to see. So VIA is like the cause, isn't it? So if I do my VIA and it is positive, there are some forms I'm supposed to draw what I've seen. So the form has a cervical map around there. So there's where I've seen the lesion, so I will draw. You know, now the VIA is positive, but this is where the lesion is. So that when it comes to treatment, I know naenda kutibu wapi, si ndio? But before even utibu tena, you apply tena the vinegar, so that wakati unatibu unajua this is where I want to treat, si ndio? Yeah. So treatment for a lesion that is less than 75% of the ectocervix, and you can see all the margins, you can treat via freezing, which freezing, yes, using nitrogen gas. Yes, so there's a procedure called cryotherapy. So you use some probes that are connected to a cylinder with nitrogen gas. Then they freeze the cells. If you freeze cells, yes, you kill them. If you freeze a cell, it dies because of the extreme low temperatures. The cell dies. So if you freeze the area where there are those cancerous lesions, those cells there, they will die, all of them.
And the cancer won't come back?
Yes.
Won't come back.
As long as you can see the entire area with the lesion, and you are sure that this lesion is not more than 75% of that outside the cervix. So if it is more than 75%, there's another method called lip or LITS. So it's where they cut that area yenye iko na lesion, because ni kubwa. They don't cut your entire cervix, they just cut the area where there is a lesion. So when they remove that area, they've stopped it from spreading. So that part that has been affected is no longer there. And that part
that's
that
when people get body parts cut off.
So yes, for whatever reason. So hiyo yenye itatolewa, it is taken to a lab for now another analysis. Inaweza kuwa histopathology, hizo vitu tunasemanga biopsy, ndio. So wanaweza kuangalilia na kuambia by the zile cells tulipata hapa in this type of cells. Hivyo unaweza jua the type of cancer ungepata. Sawa. Yes. So in other words, ukifungua the cervix, ukifungua the vagina na uone the cervix already has either a wound ama something that is discharging very foul smelling, it means you're not even supposed to scream, because already there's something happening. What you need to do is for you to collect specimen for testing. So for those who have suspicious lesions for masses, the cervix is suspicious for cancer, you will not even go to do a VIA. Because you've already seen some things happen.
There's something wrong.
Yes, it is too late for us to do the VIA. Yes, but also the good thing is that cervical cancer is the only type of cancer that is 99.9% preventable.
Or cervical?
Yes, 99.9% preventable. So it is 100% for Hakunanga absolute number, sindio?
Yeah.
Hatuna ile hatuwezi sema ni 100%, but the rate at which tunaweza prevent inamaanisha sahihi nikiweza pata lesion na ni treat. It's over. Unless you get another infection, the process starts again, which takes again a long period.
Like how long would it take? Like how long?
It takes a minimum of 10 to 15 years.
10 to 15 years.
Yes. For you to see a sign, not the cancer, for you to see a sign.
15 years.
Yes.
So hata naweza kuwa niko nayo nimetulia tu. Sijui.
Yes, how
15 years later inaamka tu.
So 15 years to say that is why now we have intervals za kufanya screening. So like if I do a via to a HIV positive woman and it is negative, I will schedule them for 1 year. They come for another screening. That is because HIV increases the risk of developing that cancer. It is 6 times higher than for a person who is HIV negative. So for someone who is HIV negative, if I screen you today, na iko negative, I want to see you in the next 3 years. So the intervals ina vary kulingana na the status ya mtu.
So mimi nikifanya leo, nitaifanya tena lini?
Sasa sijui unless now we know your serum status ama you know your serum status. If you are negative, tutaifanya after 3 years. If you are positive, then tutakwambia then kama hii next year we need to do it again.
Jua hata nilikuwa nikuulize how regularly should you do it?
Yes.
Yeah.
The question is answered.
So if you're okay, ukipatikana uko sawa in 3 years. Kama uko sawa, of course treatment na.
You see kama kuna shida, tunakuanzisha mambo ya treatment. But kama kuna shida, depending on your HIV status, we have those different intervals.
Lakini treatment kiasi unasema sasa kurudi itakuwa.
So tukikutreat kama sasa tumefanya hiyo therapy. Kuna njia tumesema ziko 3, lakini kama nimesema 2, kwa nimesema ni ile ya kukata kama ni kubwa na cryotherapy, and then there's another one called thermoablation. Ablation is like heating ama burning. So there's another way to burn the tissues. Yes, but it is not burning.
Ile chemo
No. Chemo ni kama kuna cancer sasa, like the cancer. So thermoablation is where you use a machine or a device that inakuwa heat. Kuna zingine heat. Yes. So it heats the area that has the issues. So the same way we look freeze cell inakufa, hapo ukihit a cell itakufa. So ukitreatiwa, you're usually supposed to be reviewed ama to be screened again after an year. Ukitreatiwa utaangaliwa after 1 year. Sawa? Yes. But sasa ukitreatiwa kuna zile vitu unaweza ona because ukishachoma ukichomwa na moto kwa skin, what happens? The skin itachomeka, utaanza kuwa na maji na mwagika. So similar, kuna zile complications after umetibiwa. So unaweza pata kitu kama hiyo ya discharge, kidogo hapa na pale, utakuwa na kidogo uchungu because cervix is part of the uterus, na uki-excite sana unapata lower abdominal pain na sengine mgongo kidogo. But ukianza kupata fever ama uanze kusikia baridi, uanze kusikia discharge inanuka ama una bleed, hiyo inamaanisha you're supposed to come because something might have happened. Maybe an infection came after umetibiwa, so you have to be treated. So those are things to watch out kama mtu amepatikana na the problem na ametreatiwa. Ukifriziwa na ukifanywa ile ya heating, the complications are usually the same. But for kama hakuna shida yoyote, utapata discharge inaendelea for a short period then itawacha. But for that period yenye unapata hiyo discharge, then the issue of sex lazima tuangalie because now you don't want also to cause other problems. So not abstaining, if you can abstain, but if you cannot abstain, unaweza ambia mzee, leo tumeenda kutibiwa.
Wait, ngoja. So mimi nikifanya screening leo.
Au kiscreeniwa is different na treatment. Ukiscreeniwa unaendelea kawaida. Ukienda kupeana. Lakini ukitibiwa is when we have those so kuna hiyo mambo ya unaweza abstain ukitaka, but kama huwezi abstain, then the other person should at least use condom.
Na so umesema unafanya prostate free, sio?
Yes.
So mzee anaweza fanya prostate.
Yes, anaweza fanywa.
Okay, akikubali si.
So the prostate Prostate examination involves digital rectal examination, which means you can only examine the prostate through the anus.
So kumaanisha na
a finger has to go inside the anus. That is how we do the prostate exam.
Alafu unafanya sijui sperm count.
Sasa hiyo ni mambo ya lab. Hiyo ni mambo ya lab. Hiyo ni mambo inaweza angaliwa kwa lab, but that is also possible. That is doable. Yes. So prostate exam it depend na mtu kama comfortable. Because you see now these issues lazima mtu kwa psychologically prepared. Yes. And also another thing I forgot to mention about the issue of cervical cancer, the rate at which women die of cervical cancer at the moment, kulingana na report ya 2022, we are losing 9 women every day due to complications of cervical cancer.
And these are women who have been treated?
No, these are women
who have been under...
They might have been treated, but maybe ilikuwa ishakuwa cancer, so they will probably die. Sindio?
And is the cancer killing them?
Yes, it is the complication of the cancer. You see, when a cancer imefika stage kama 4, then it will definitely kill you because it causes anemia. It gives you pain. You get other infections. You get donor here and there. Organ errors, all those things. So we are losing 9 women every day.
Leo tunaweza count 9.
Yaani leo ameshaenda. So kwa wiki tuko na kama 60 something hivi watakuwa wameenda. Now, shockingly pia, breast cancer also in a claim 7 women every day. So no cervical cancer and breast cancer so we have to like improve our screening. We have to ensure people are screened so that at least when you can share see wengi, but the few that have problem tunafaa kujua mapema na tuwatibu. Sawa. Now, a good thing about breast cancer screening is something that even the patient or the client can be taught how to do a self-breast examination, which you can schedule yourself to do monthly, so that when you find a problem, you come to us and report. By the last time you did, there was no problem, but I can feel a lump in my right breast at this part. I can feel I have nipple discharge and I'm not pregnant and I'm not breastfeeding. You see?
Get nipple discharge?
Yes. Yes.
Yes. Is possible.
So there's a lot to be done, and here at MDH we are trying to see if we can bridge the gap. We see if we can get as many people as possible screened for the various types of cancers, so that tuone wenye wanafaa kusaidika na pia watu wapate a lot of education.
By the way, do you guys offer cancer education like on groups on a plan?
Yes.
Yes. On this day there will be cancer.
Actually, we are doing that.
It's cancer day.
Directly, we are doing that.
For real?
Yes.
Call me when you're doing that.
So another part. Another part. Nataka tutaedit kwa this video. When we are doing the outreaches, the enriches, is when now these services we offer them for free. But on any other day, there is a package for this service. So the package, yes, because now we have things we buy, we use for screening them. So the package involves now the consultation, physical examination, the screening, and also we also do an ultrasound, a pelvic ultrasound to sum it up all. So hii itakwambia kama kwa examination tulipata kitu, we write a report. Kama kwa screening tulipata kitu, we write a report. Kama ultrasound tulipata kitu, we write a report. So you have like a comprehensive check-up. Kama ni cervical cancer, kama ni breast cancer, pia the same for breast cancer. We do the usual history, clinical examination, and we also offer a breast ultrasound. Yes.
Wow, guys, watu wangu MBH Medical, simnasikia. These guys have just the best. The information I'm getting today, I didn't even know so many things. So I'd advise you, please come get your cervical cancer screening, get the education, the basic nini unafaa ukijua. Nakwambia Kiingereza ni ngumu, lakini tunasonga.